this lecture, we will review Bipolar I Disorder according to the DSM-5-TR. The diagnostic criteria is as follows. For a diagnosis of bipolar I disorder, it is necessary to meet the following criteria for a manic episode. The manic episode may have been preceded by and may be followed by hypomania or major depressive episodes. A manic episode is a distinct period of abnormally and persistently elevated, expansive, or irritable mood and abnormally and persistently increased activity or energy, lasting for at least 1 week and present most of the day, nearly every day, for any duration if hospitalization is necessary. During the period of mood disturbance and increased energy or activity, 3 or more of the following symptoms, 4 if the mood is only irritable, are present to a significant degree and present a noticeable change from usual behavior. 1. Inflated self-esteem or grandiosity. 2. Decreased need for sleep, such as feeling rested only after 3 hours of sleep. 3rd, more talkative than usual or pressure to keep talking. 4, flight of ideas or subjective experience that thoughts are racing. 5, distractibility. Attention too easily drawn to unimportant or irrelevant external stimuli, as reported or observed. 6. Increase in goal-directed activity, either socially, at work or school, or sexuality, or psychomotor agitation, like purposeless, non-goal-directed activity. And 7, excessive involvement in activities that have a high potential for painful consequences, such as engaging in unrestrained buying sprees, sexual indiscretions, or foolish business investments. Let's move on to C. The mood disturbance is sufficiently severe to cause marked impairment in social or occupational functioning or to necessitate hospitalization to prevent harm to self or others, or there are psychotic features. D. The episode is not attributable to the physiological effects of a substance, such as a drug or abuse or a medication or other treatment, or another medical condition. Note, a full manic episode that emerges during antidepressant treatment, for example, medication or electroconvulsive therapy, but persist at a full symptomatic level beyond the physiological effect of that treatment is sufficient evidence for a manic episode and therefore a bipolar I diagnosis. Note, criteria A through D constitute a manic episode. At least 1 lifetime manic episode is required for the diagnosis of bipolar I disorder. Next, hypomanic episode. A distinct period of abnormally and persistently elevated, expansive, or irritable mood and abnormally and persistently increased activity or energy lasting for at least 4 consecutive days and present most of the day, nearly every day. B. During the period of mood disturbance and increased energy and activity, 3 or more of the following symptoms, 4 if the mood is only irritable, have persisted. and a notable change from usual behavior and have been present to a significant degree. 1. Inflated self-esteem or grandiosity. 2. Decreased need for sleep. 3. More talkative than usual. 4. Flight of ideas or subjective experience that thoughts are racing. 5. Distractibility. 6. Increase in goal-directed activity. 7. Excessive involvement in activities that have a high potential for painful consequences. C. The episode is associated with an unequivocal change in functioning that is uncharacteristic of the individual when not symptomatic. D. The disturbance in mood and the change in functioning are observable by others. E. The episode is not severe enough to cause marked impairment in social or occupational functioning or to necessitate hospitalization. If there are psychotic features, the episode is, by definition, manic. F. The episode is not attributable to the physiological effects of a substance or another medical condition. Note, a full hypomanic episode that emerges during antidepressant treatment but persists at a fully syndromal level beyond the physiological effect of that treatment is sufficient enough for a hypomanic episode diagnosis. However, caution is indicated so that one or two symptoms, particularly increased irritability, edginess, or agitation following antidepressant use, are not taken as significant or diagnoses of a hypomanic episode, nor necessarily indicative of a bipolar diagnosis. Note, criteria A through F constitute a hypomanic episode. Hypomanic episodes are common in bipolar I, but are not required for the diagnosis of bipolar I disorder. Next, let us review major depressive episode. A. 5 or more of the following symptoms have been present during the same 2-week period and represent a change from previous functioning. At least one of these symptoms is either 1. Depressed mood, or 2. Loss of interest or pleasure. Note, do not include symptoms that are clearly attributable to another medical condition. 1. Depressed mood for most of the day, nearly every day, as indicated by either subjective report, such as feels sad, empty, or hopeless, or observation made by others, such as appears tearful. Note, in children and adolescents, can be irritable mood. Second, markedly diminished interest or pleasure in all or almost all activities most of the day, nearly every day, as indicated by either subjective account or observation. 3. Significant weight loss when not dieting or weight gain, such as a change or more than 5% of body weight in a month, or increase in appetite nearly every day. Note, in children, consider failure to make expected weight gain. 4. Insomnia or hypersomnia nearly every day. 5. Psychomotor agitation or retardation nearly every day, observable by others, not merely subjective feelings or restlessness or being slowed down. 6. fatigue or loss of energy nearly every day. 7. Feelings of worthlessness or excessive or inappropriate guilt, which may be delusional, nearly every day, not merely self-reproach or guilt about being sick. 8. Diminished ability to think or concentrate, or indecisiveness nearly every day, either by subjective account or as observed by others. 9. Recurrent thoughts of death, not just fear of dying. Recurrent suicidal ideation without a specific plan, or a suicide attempt, or a specific plan for committing suicide. B. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. C. The episode is not attributable to the physiological effects of a substance or another medical condition. Note, criteria A through C constitute a major depressive episode. Major depressive episodes are common in bipolar I disorder, but are not required for the diagnosis of bipolar I disorder. Note, responses to significant loss, such as bereavement, financial ruin, losses from a natural disaster, a serious medical illness, or disability, may include the feelings of intense sadness, rumination of the loss, insomnia, poor appetite, and weight loss noted in criterion A, which may resemble a depressive episode. Although such symptoms may be understandable or considered appropriate to the loss, the presence of a major depressive episode, in addition to the normal response to a significant loss, should also be carefully considered. This decision requires the exercise of clinical judgment based on the individual's history and the cultural norms of the expression of distress in the context of loss. Moving on to bipolar I disorder. A. Criteria have been met for at least one manic episode. Criteria A through D under manic episode. B. At least one manic episode is not better explained by schizoaffective disorder and is not superimposed on schizophrenia, schizodelusional disorder, or other specific or unspecified schizophrenia spectrum and other psychotic disorder. Coding and recoding procedures. The diagnostic code for bipolar I disorder is based on type of current or most recent episode and its status with respect to current severity, presence of psychotic features, and remission status. Current severity and psychotic features are only indicated if full criteria are currently met for a manic or major depressive episode. Remission specifiers are only indicated if the full criteria are not currently met for manic, hypomanic, or major depressive episodes. The codes are as follows for bipolar I disorder: manic, hypomanic, depressed, or unspecified. In recording the name of a diagnosis, terms should be listed in the following order: bipolar I disorder, type of current episode, or most recent episode if bipolar I disorder is in partial or full remission, severity, psychotic, remission, specifiers, followed by as many of the following specifiers without codes as applied to the current episode. Or the most current episode of bipolar I disorder is a partially or full remission. Note, the specifiers with rapid cycling and with seasonal pattern describe the pattern of mood episodes. So you would need to specify if on page, and this is on page 169 to 175 of the DSM-5-TR, specify, is it with anxious distress, or with mixed features, or with rapid cycling, or with atypical features, or mood congruent psychotic features, or mood incongruent psychotic features, or if there's a seasonal pattern. Please note, when entering your codes, you must specify whether or not symptoms are mild, moderate, severe, with psychotic features, in partial remission, in full remission, or unspecified.